Namaskar, my dear brothers and sisters. It is a historic time for our country, and we are witnessing the beginning of transformation under the leadership of Sri Narendra Bhai Modi. As part of this transformation initiative, BJP as a party has focused on the challenges and solutions for the people with disabilities. As a representative of this community, having global exposure as well, today I would like to share with you our thought process and creative approach to manage some of these complex disability challenges in our country in next 5 years. Friends, we have also published our Vision 2020 for empowering the specially able citizen, which you can find at india272.com. To create awareness across the country, we have prepared this presentation, which has the agenda, which would include our vision, our mission, and how we can achieve transformation with 5 A's. Then we'll talk about understanding the disability issue in the Indian context. And then we'll have around 11 challenges uh, discussed and with the solutions proposed for those challenges, which will change the lives of almost 10 crore people of our country. So let us start with our vision. The vision that we expect would help our country to transform by year 2020. Let me read the vision. Empower the specially able people of India to contribute to society by creating barrier-free environment in which the specially able will be able to live, learn, work, and participate inclusively in the development and high growth of India. In this vision, our emphasis is on the contribution to the society by people with disability if we ensure the infrastructure and the access barrier-free environment. Another focus is participating in the growth of our country. Like we say, Sabka Saath, Sabka Vikas. To achieve this vision, we have come up with our mission also. The mission statement reads to create a disability friendly and rights based society with opportunities for the optimum utilization of potential in each and every person, irrespective of the type and intensity of the disability. We have got 5 points also in this mission, which reads to increase, the first point is to increase social awareness, which is very important because there is huge amount of ignorance. Second point in the mission is to create congenial and barrier-free environment in India through legal means and administrative effectiveness. The third point in the mission is to transform our society into a rights-based society which is friendly place for persons with disability. Fourth point is provide opportunities for optimal potential development and utilization regardless of the disability. Fifth point, to reach out to the remotest area and every citizen of India. In a nutshell, we believe that transformation can be achieved by following these following 5 A's. The first and foremost A is appeal to persons with disability to reach out to the polling booth and vote for the empowerment. Second A is create the awareness, massive awareness across the country regarding challenges, solutions, and Vision 2020. The third A is act. We need comprehensive law and legal protection for the rights of people with disability. Fourth A, which is commonly impacting to everybody, is regarding accessibility, both social and physical, to create a barrier-free environment. So it's very important to create a barrier-free environment. We must have accessibility. The fifth A, and to achieve the transformation, we need resources. So it is basically allocation of resources uh, for transformation. So in short, appeal is immediate and awareness is very, very important while ACT is critical, like a bedrock, to really do this transformation. Certainly, we have to ensure the allocation. So India is ready, and under the leadership of Sri Narendra Bhai, to transform the lives of almost 10 crore people who are living with some sort of a disability, who are called specially able people as well. So let us understand disability in the Indian context, the legislative history. We passed the first Persons with Disability Act, PWD Act 1995, in as a follow-up to the 1993 UN Guidelines Treaty. Then the national policy on PWD was developed in 2005, almost after 10 years. In 2007, we signed the UN Treaty for Rights of People with Disability. Since then, almost 8 years now, we have not been able to pass any law to ratify to implement what we have signed with UN, and that is not a good situation, and it is not good for disabled people of our country as well. The bill is pending with the standing committee in the parliament. And last point is, even our states, most of the states do not have any disability related policy. Bolo. So India has some sort of legislation, but they are vague, ineffective, and yielding no results to the lives of disabled people. It is important to note that UN is driving the change across the world for the people with disability. And in 2006, it was the largest human rights treaty at the UN General Assembly that was, you know, people with disability, and essentially addressing all the issues of people with disability across the world. India, along with another 158 countries, signed this treaty to implement various principles of the treaty. Friends, countries like Brazil and China, who are also developing countries, have done far more in this area after 2007 treaty, and India has yet to pass the law. The key principles of this convention are, some of them are non-discrimination, accessibility, equality of opportunity, equality between men and women, etc. So it is now time for us to act. And let me explain you why we need to act and act now. First of all, 8% of the population, the human capital, is underproductive, has remained liability for the family because of ignorance and exclusion at every level. World is changing, technologies are available now, and for example, 77% of the people with disability, our NSS data says, that can be self-sufficient for basic things if they have been provided by some aid or support. It's a great untapped socio-economic opportunity. We are very fortunate to have now political will also at the highest level, like Sri Narendra Bhai and the BJP leadership, to transform. So it's time that opportunity we have to seize in order to, uh, you know, bring the change. A couple of other points, like young India, or the population in India is very young, and who also understands that everybody is temporarily able, so they all want to create a society which respects the rights of people with disability, because everybody is temporarily able. And another viewpoint is that by focusing on this sector, it will create thousands of new service sector jobs also, in terms of training, caretaking, etc. So let us look at this timing, this opportunity, to from a different angle, as a socio-economic opportunity. At this point, let us also look at some of the key facts or the statistics also. As per National Sample Survey data, disabled population in India is likely to grow, especially in the category of injury-based disability, which is expected to double between 1990 and 2020. Another fact is, people with disabilities in India are subject to deprivation. in various dimensions of the life, education, employment, justice, etc. Unacceptable to see this miserable quality of life of 8% of our people population. Education, the data says 5 times higher dropout within students with disability compared to other students. We can keep on going. The bottom line is that we have large number of NGOs also, almost 8,000, but the integrated service delivery is missing. And as we all know, there are policy frameworks which are vague. It just reflects the fact that there is a lack of political will in our country. So now, before getting into the list of challenges and solutions, let us understand that there are 8 different focus areas at a high level that we all need to focus together in order to bring the transformation. First and foremost is the definition of disability, which is quite of incomplete and not compliant with UN or WHO standards. Accessibility, lots of issues. Education, employment, healthcare, attitude towards disability and disabled people, uh, missing social security net, and last focus area is institutions and policies. So friends, here are list of challenges that we have identified based on lot of feedback from thousands of our volunteers across the country. At a high level, although there are lots of challenges, but we have to narrow down and group and focus on certain most important challenges. And we have come up with 3 categories. First is governance related challenges. Second is operational challenges. And third is social challenges. We'll talk more in details about each of these challenges, but at a high level, within governance challenges, it is lack of political will, hence no comprehensive rights or legislation for people with disability, no voice or representation in any elected body. The whole perspective of governance is welfare rather than human resource development opportunity. On operational side, it's a lack of accurate data. There is no enough data, even at the census level. Inadequate resources to develop skills, infrastructure, accessibility. Lack of programs for children and women with disabilities. Very high level of illiteracy and poverty. Certainly, discrimination by society and employers is a huge challenge in our society, in our country. And the last operational issue is lack of healthcare and rehabilitation related services. When we look at the social challenges, we know that social stigma, lack of understanding, and that leads into even lack of awareness for the preventable disabilities. Uh, Disability and aging is also a big challenge in our country because we are kind of completely ignorant that senior citizens and the aging related disability issue is a big population and a lot of issues are there. The first governance challenge is lack of political will. Historically, our political leaders have been very ignored for the rights of 8% of the population. And there are several other related issues like vague and ineffective law or the legal structure, a disability commissioner's office usually under-resourced, underfunded, so hardly anything they can do, even though the position is there for every state. So what is the solution? We believe that create massive awareness among people, elected leaders, and government officers. That is the first thing because everybody, once they know about it, then they will be inclined to do something about it. We firmly believe that elect BJP leaders who are supporting the Charter of People with Disabilities, and certainly Sri Narendra Bhai is supporting this cause, so and BJP leadership. So please make sure that all the BJP member of parliaments are elected because we anticipate a comprehensive rights bill to take care of fundamental issue of providing rights to the disabled community, and we have to pass that comprehensive bill only if we have our own elected BJP office member of parliament. The next challenge is there is no voice of people with disability. and hence there is no political representation despite of such a large population. Due to challenging life and social stigma, political participation is almost minimal or not non-existent. We have Ministry of Social Justice to take care of issues related to people with disability, but their prime focus has been historically only for SC/ST related issues. So what is the solution? We believe that due to inspire and facilitate all the people with disability to exercise their right to vote and reach to the polling booth. We want to create a separate ministry at the center and the state level to handle the issues related to people with disability. And certainly should have a reservation in every elected government body like women's reservation, SC/ST. We need to have including Lok Sabha and Rajya Sabha for people with disability, the reservation. The third challenge is the perspective. Once we start looking at 8% untapped resources from the human resource development opportunity perspective, think about it. Even 10% increased productivity will result into 0.8% increase in the GDP. Cost of welfare is always far more than cost of investment into development or empowerment. So we firmly believe that the solution lies in changing the perspective. Yes, create the resources to fund the required programs for investment into this sector. Maybe temporary cess or the tax could be there, or invest into human resources with the help of NGOs or corporate CSR etc. programs. But we need to change our perspective in order to tackle this issue or the challenge. Let us now start looking at the operational challenges. The first and foremost, there should be some data for any policy, effective policy to be prepared. Unfortunately, in our country, there is not enough accurate data, including census. We have to fix that. Majority of the population of disabled people is residing into rural and tribal area, and that population is highly undercounted. Even our methodology of counting or interviewing the people has lots of limitation because it's diagnostic based. So UN expert group has already identified this as the biggest hurdle in our way of counting the disabled population in our country. There is also social issue, ignorance, shame, societal neglect, etc. act as a barrier to share the accurate information when it comes to census workers sharing the information with them. So we propose that there should be online mandatory registration system, issue a smart card or maybe update Aadhaar card application, define disability as per UN and WHO standards, so it reduces the chances of human error, and it is making like everybody is counted and they are tracked right from their birth to various diagnoses that happens during school and hospitals and other organizations. So make it mandatory, issue the card, and this problem can be solved. Challenge number 5 is inadequate resources to develop skills, infrastructure, and accessibility. Friends, we know the accessibility is a huge issue in our country. A person with disability cannot access government buildings, public buildings, even banking at times. Uh, Public transportation, same issue, bus, train, not accessible. How can they live a life? How can they come out of their home? It's very, very difficult situation. Um, we have, and top of that, we are expecting the better infrastructure or the skill development possibilities, but because of the accessibility issues, the education is also impacted. So less than 10% persons people with disability are receiving skill training. What we need to do? We need to make a mandatory compliance for accessibility, and if it is not, penalize as a percentage of the building cost. A very huge impact with the right amount of penalty. There is no government spending. All private sector public buildings would be complied at the first level. Certainly, government will have to do that their part also, but they can also use the CSR money. Maybe 20% of the CSR money should be allocated for vocational training centers, infrastructure development, etc. And another thing that part of the solution could be for uh, you know by subsidizing the use of aids or equipment or for mobility or adaptive technologies so that people with disability can be mobile and develop their skills. The next challenge, number six, is lack of programs to reach children and women with disabilities. Lack of early identification and early intervention services is the biggest challenge. We have our healthcare providers even not knowledgeable about it, or very not limited knowledge with the school teachers also to identify learning disabilities. Uh, if we can treat these challenges at the early stage, it it stops further deterioration and it can be much better managed. That's what we believe. And that's why, as part of the proposed solution, we believe that there should be compulsory screening of all the newborn for detecting any disability that could be there. Train all the teachers in the primary school for early identification and intervention. Make, you know, com- uh, also related to women, we should be more sensitive to their needs, especially on the accessibility as well. And we need to make sure that building code is updated so that they have easy access to the even to the basic needs of bathroom or washrooms. As we all know, uh, literacy or the education leads into economic growth. Unfortunately, people with disability, we see very widespread illiteracy, which results into poverty. Even more than 20% people, because of lack of education, are even begging. Not acceptable. So we believe that if we focus on education as part of the solution, make a mandatory and free education at every level for people with disability, introduce e-learning, web-based education for up to 12th standard as an approved option so that if those who cannot reach to the school for any reason, they can still study with the technologies available these days. Enforce the inclusive education without labeling the children because that's the best way they will learn. So focus on education with creative means and technology will be the solution to reduce the poverty and illiteracy. Challenge number eight, discrimination by society and employers. We have noticed, we have come to know, and we have data points that even engineers are unemployed, engineers with people with disabilities. Very frustrating reality. Less than 20% people are gainfully employed. Society also neglects the aspirations and capabilities of specially able people. These are our social issues as well as operational issues because we don't have enough um, legislation to ensure there is no discrimination. So we believe that we should have, first of all, provide incentives to employers to employ people with disability, provide 5% reservation in the jobs in the private sector also, create a fund for self-employment because many people with disability uh, can be a self-employed individual and that is possible. We have seen number of such individuals. uh, and certainly enact strong law to prevent discrimination due to disability. India has lots of IT, BPO, lots of jobs that people can perform. They need to be given the opportunity and make it the prime priority of the government. Next challenge is lack of healthcare and rehabilitation centers services. We have inadequate expertise to manage the healthcare issues related to people with disability, even with the healthcare professionals. Insurance sector excludes providing insurance, even though they have huge expenditure because of their health conditions. Insurance is not there. Rehabilitation centers are primarily located in urban areas, while the large population is in the rural sectors. So, we believe The solution lies into creating educational institutions across the country to create professional caretakers, speech therapists, trainers, healthcare providers, etc. as per NSDA guidelines. Government should provide the insurance to people with disability till the reforms for insurance happens. We should create community-based rehabilitation centers which are low cost and can support the community and their needs. So we should be having big focus on that as well to deal with the rehabilitation and healthcare related issues. So we have covered all the operational challenges, all six operational challenges. Let's look at two major social challenges. The first one is lack of understanding and awareness towards preventable disabilities. Because of having social stigma or lack of education and awareness, friends, we can have many scenarios where we can prevent the disability, let's say blindness because of diabetes, or better, injury-led disabilities, which can be reduced by better, education as how to drive safely. Communicable diseases we can prevent by having better sanitation and vaccination. So, primary component of the solution would be provide all the basic education at the school level so that people understand what are the preventable diseases or disabilities. Definitely focus on safe driving and awareness programs related to that. Promote and fund programs to ensure vaccination of children and women. We are now, after so many years, able to declare polio-free country because of huge focus on vaccination. We should do that in every other disease that would lead into disability. The last social challenge is recognizing the fact that disability and aging is very a reality in our country. Because of aging with the senior citizens, many disabilities are taking place. Many of them are preventable, but frankly, they can be taken care of if we recognize that aging brings the disability, and that also makes the part of the population of disabled people in our country. We will be focusing on that in terms of creating awareness as how to prevent that, have geriatric medical practice to handle it, create a social security tax in order to take care of old age and related disability and the economic conditions because of that. So it is high time even India should look at, like Western countries, to create a social security tax so that social security net is created, and that will be helpful for all senior citizens, even if uh, they are disabled or not. Certainly, it will help a lot if they are disabled because of the aging. So, friends, we have attempted to give a very unique perspective to disability related challenges and the solutions in India that we can bring together, we can implement. We have an unprecedented opportunity to come together and work together to implement the transformation, which Sri Narendra Bhai and BJP leadership commitment. We appeal you all to spread this awareness and elect your BJP candidate for the majority in your parliament in coming elections. Please feel free to reach out with any question that you may have. You can reach out to me, myself Pranav Desai, or Dr. Indumati Rao. We'll be very happy to work with you, guide you, and ensure that you also become uh, part of the movement and initiative to bring in this transformation in next 5 years. Thank you. Jai Hind. Vande Mataram.